Thank you, Minister. As you're all aware, the Transition Committee met this morning and there was a very productive conversation in relation to the current arrangements, the status with the Parafield cluster, and it was made clear by Professor Spurrier that the preferred way forward moving into the next phase of this particular response is that we retain social distancing of one person per 4 square metres across the board, and that we reconsider our position as we move into next week, aiming for a potentially earlier relaxation of those restrictions on Friday next week. Having listened to that and looked at the performance of the South Australian community in relation to the take-up of the use of QR codes, where we are at currently over 1.1 million check-ins across the state, which is exceptional, and also looking at the economic and social factors in relation to the restrictions that are currently in place, the advice from the Transition Committee as a whole was that the best course of action would be to move to a distancing requirement of one person per 2 square metres for hospitality. Other activities are still restricted to one person per 4 square metres, but given the economic implications, the impact on employment, the current time of the year, our current performance with the Parafield cluster, and the new measures we have in place to enhance contact tracing, my decision has been that we will endorse a one person per 2 square metre rule for hospitality particularly. All of the other restrictions that are currently in place that we're dealing with will remain and be reassessed during the course of next week, but we are still hopeful that those other restrictions will be lifted and we'll go back to where we were in mid-November on the 14th of December. But as we have advised previously, we constantly review the circumstances and we make decisions based on the best advice available to us at the time. So this is the position moving out of today. Effective immediately, hospitality will be able to revert to one person per 2 square metres, and we will continue to consider the management of the Parafield cluster and the impact on those restrictions as we move forward during next week. I'm happy to take some questions about this prior to handing over to Professor Spurrier, who can give the daily update.
Seated or standing up?
It will still be retained at seated consumption. It is clear that we are not out of the woods entirely in relation to the Parafield cluster. There's been exceptional work done by the contact tracing team in health. We are now at a position where we only have somewhere in the order of about 275 people in home quarantine. And you may remember the numbers were up around 4,000 or 5,000 at the height of our response to this particular cluster. That, taking into account the take-up of QR codes, has given us some confidence to manage the risk around this current response to the Parafield cluster. And that's the decision we've taken. But in order to continue to have some impact on general movement, we are retaining seated consumption until the 14th of December at this time.
How difficult were this morning's discussions when you were obviously at odds with Professor Spurrier about what should happen in terms of the hospitality restrictions?
Well, I wouldn't describe it as being at odds. I think the relationship between SA Health and Police throughout the entire course of this pandemic has been a productive one. There is what I would describe as a healthy tension where we need to take into account all of the advice and all of the circumstances. We look at this from a public health point of view. We look at it from a social and an economic point of view as well. There are some commentators out there that suggest that we need better representation on the Transition Committee to ensure that small businesses and other people affected by our decisions are properly accommodated. I can assure you, with the presence of the Under-Treasurer and the Chief Executive for Trade and Investment being on the committee, that those arguments are well placed every single meeting. So the relationship is exceptional. The health advice is a key factor in our decision making, and there are times when the health advice must override every other consideration, and I think we were in that situation back on the 18th, 19th of November. Circumstances were very different. There was nothing that was going to override the very clear health advice, and I was very happy to take it. But it is a collaborative approach in the Transition Committee, and my decisions are informed by that process.
So it's Friday. It's going to be very short notice for hospitality to restock and get back into action. Wouldn't this have been better to come 24, 48 hours ago when the industry was asking for it, rather than leave it till...
Well, I can tell you now that we were talking about this on Tuesday in the Transition Committee, and the health advice was much stronger in relation to any relaxation at that point in time. As I said, we review this constantly, and The decision to allow one person per 2 square metres in hospitalities is being made effective immediately, because we appreciate that there are some businesses that can take advantage of that now. We don't hold on to these decisions until it suits us to announce them. It's constantly reviewed. We make these decisions and we announce them. And in this particular case, we have determined not to wait until we've updated the COVID safe plans. Businesses can operate at 1 person per 2 square metres effective now, and we will update their COVID safe plans and send them out to them as soon as we can, but we'll be taking a compliance approach that is around 1 person per 2 square metres.
Commissioner, you talked about QR codes and the uptake of that. Was that your sole reason to override Professor Spurrier's health advice, or were there other factors that you took into account, such as the economic damage that was clearly happening from 1 per 4 square metres?
Well, I think the QR codes have been described as a game changer in terms of contact tracing, and the exceptional work that's been done to quarantine this cluster and put a ring around it so it doesn't spread any further through the community has been exceptional. We are in a much better place now than we were a week ago, and we have much more information now about exactly what the risks are. So QR codes was a key factor in our decision, but it is also about an appreciation of the economic and social impacts of the restrictions that we have in place at this point in time of the year. It is about risk management. We are not saying that we are entirely on safe ground here to move forward, but it's about finding that balance, and we know that we're able to respond quickly and effectively if we do identify another part of this cluster that hasn't been identified at this point in time. We are managing risk. This is people must understand it. This is not a laissez-faire decision. It's not something that's taken lightly. We don't put these restrictions on in a ad hoc way, and we don't remove them lightly either. We think about each step and the possible implications.
How are you finding compliance with the QR codes? I know personally it seems to be a little bit hit and miss for some vendors.
Well, look, we're in the early stages of a new way of living in South Australia with QR codes. We've always said that we would support industries and businesses to get on board. What we see is a genuine endeavour to do the right thing, and we'll get there over time. This is a new part of living in South Australia, and it's going to be with us for some time. So there's a level of tolerance from a compliance point of view, but we do expect people to take it up, and we do expect people to support businesses who are using QR codes.
Commissioner,
do you know how many people have crossed the Victorian border since it opened?
I don't have the specific numbers, but we are seeing an increase in the number of travellers crossing from Victoria into South Australia. That's something we're monitoring very closely, because we need to make that decision about at what point does it become unsustainable for us to have a resource allocation to greeting people as they come into South Australia. But at this point in time, we still have police officers there, and we'll still require people to do the pre-approval process, but we are watching that every day.
How can police have to caution or fine any businesses who haven't had the QR codes, and will you be taking a tougher approach now that we are reverting back to the 1 person per 2 square metre rule?
We'll maintain the same enforcement approach that we've had right throughout the course of this. As I've said before, our observation is that businesses genuinely are trying to do the right thing. We do have some businesses that clearly just disregard the rules, and we deal with them appropriately. But we are there to support business and the community. Most of the visits by police where we identify non-compliance is dealt with through support and education, and we'll continue to do that.
And have there been many of those in the past?
We have been providing advice and assisting businesses to understand how to apply the QR code process correctly. There have been no infringements or formal warnings that I'm aware of for people not using their QR codes. And it's also important to remember that QR codes are mandatory for certain businesses, and we will be expanding that list probably in the coming week. But businesses must also provide an opportunity for people who don't have access to smartphone technology to record their name and phone number in handwritten form.
How do you feel that the Spanish national wasn't charged?
Beg your pardon?
How do you feel that the Spanish national wasn't charged?
I think Assistant Commissioner Peter Harvey in his briefing gave a fairly detailed summary of the South Australia Police position, and I don't intend to elaborate on that.
Commissioner, do you, just following on from that, do you have any concerns, or are there any concerns about the implications on compliance and people not telling the truth to authorities? And does that undermine your message to cooperate, to do the right thing? But if you don't, there's no punishment because your medical records are confidential.
I think Professor Spurrier can probably elaborate on this, but my advice to the community is to support the contact tracing effort because it's in your best interests, it's in the best interests of the people you care about and the wider community. We understand people struggle with recalling specific information about their activities. We have mechanisms to support them in remembering where they've been and who they've been in contact with. It's in their best interest to tell the truth, to support that process, and that's what we require of the community. We've done a fantastic job as a community so far, and we need people to keep doing that.
So you don't have any concerns that it undermines your message to the community?
We take a pragmatic approach to this. We know, think of the 5,000 odd people that have been spoken to by the contact tracing team over the course of the last couple of weeks. By and large, people support that process, and we need to focus on the positives, I think. When you live in a community, you will always have people who don't do the right thing. That's why we have police, but we deal with that.
Did you speak to anyone from SA Help before announcing on Friday afternoon about 3 weeks ago that you wanted to launch the task force?
I beg your pardon, what's your question?
Did you speak to anyone from SA Health before announcing that you were launching the task force?
We're in daily contact with SA Health. We have police officers supporting the contact tracing effort. We work alongside the policy component in relation to developing directions. There's an open dialogue